My name is Sabrina Stout, and I am a local life, health, and Medicare agent here in town. I own Sage Health Insurance Services, and this presentation is called Medicare 101. We're going to go over Medicare at a very high level. So I like to call it a 3,000-foot overview because we're not going to get into a lot of nitty-gritty specifics. We're just going to go over what people need to know as they're navigating that Medicare maze. So these are the questions we're going to go over today. These are the primary questions. I'm sure there will be more that come up. And if that's the case, please just let me know. We're going to talk about what the different parts of Medicare are, what the costs will be to you. Is Medicare enough? What if you don't take Medicare? And what if you are still working when you've come to that age 65 and want to carry on with your job? So first things first, what is Medicare? Medicare is a government federally facilitated healthcare program for people who are over the 65 and older, who are US citizens, and it's also for people who have certain disabilities and people with end-stage renal disease. So just because you're not 65 does not mean you're not eligible for Medicare. That's super important to know. And just a quick clarification, what Medicare is not. Medicare is not Social Security, which can be kind of confusing because Medicare and Social Security work very hand in hand together, but they're very two distinct agencies in the United States. And then it is not Medicaid. So Medicaid is going to be your state facilitated healthcare program for people who are low income. You might know of it here in Oregon as Oregon Health Plan. This is not going to be the same as Oregon Health Plan. This is for folks that are 65 and older. And if you've done any kind of Medicare search at all, you have encountered all these lovely letters here and probably are not entirely sure what they mean. So we call this the Medicare alphabet. Part A is your hospital insurance. So that's if you go stay in the hospital for more than just one day. Part B is your medical insurance. So that is commonly referred to as your doctor office visits. And then Part C is a Medicare Advantage plan. We'll get more into that later. And Part D, down there at the end, is the easiest one to remember because it stands for drug coverage, prescription drugs. Part A. So this is what people talk about when they say that they are getting Medicare. They're signing up with the government for Part A. It is no cost if you have worked your 40 quarters and paid into the Medicare tax. So it's no cost for most people. These are last year's terms or last year's prices right here. So it's got the costs here that you pay for any hospital stays, hospice, home health. That was 2024. 2025's numbers have not been released yet. So this is the part that you sign up for when you turn 65. And Part B, this is the other part of the government facilitated portion of Medicare. And it does have a cost for most people. It is in 2024, $174.70 per month. And it's gonna cover your doctor's offices, your rehab, all of those outpatient services, durable medical equipment. So there's a large array of things that it covers. One important thing to note about Parts A and B is that the cost share is 80-20. So that means if you just have Parts A and B, the government pays, Medicare pays 80%, and you pay the remaining 20% of that bill. So what is not covered by Medicare other than that 20% cost that you share? They do not cover dental. They do not cover vision. There's no hearing aid coverage, no long-term care coverage. And that's not hospice, but that would be if you get to the point where you can't take care of yourself and you're living in a retirement home. That is not covered by Medicare. And then any care you receive outside of the United States is not going to be covered either. So this is another question I get a lot is when do I start thinking about this? Well, in advance. So you have 7 months to sign up initially for Medicare. You've got 3 months before your birthday, the month of your birthday, and 3 months after your birthday. That is when you'll want to log on to socialsecurity.gov or call the Social Security office and get your card ready to go. And if you miss it, you will have to wait until the general enrollment period the following year. So if your birthday is in July and you've missed that window, you'd have to wait until January to start signing up for that. The coverage will start as soon as the first day of the month you turn 65. So if your birthday is in January and you call an agent in October to help you get signed up, your coverage is not going to begin until January 1st, the month of your birthday. If though you wait until January 15th, then the coverage is going to start the following month in February, and so on and so forth. So if you wait till March, your coverage won't begin until April. So how do you apply? That is the question. This is the card that you're going to get in the mail once you're all signed up there. That's what it looks like. If you are collecting Social Security at age 65, then most of the time you are automatically signed up for Part A and automatically signed up for Part B. If you're not collecting Social Security, then you may not be automatically signed up, and you will need to either go online or call the Social Security office or go into the Social Security office in Bend, and they can help get you signed up. I tell everyone it's best to just go and check to make sure that you are automatically signed up. You don't want to just wait until that last month of your open enrollment and then not have the opportunity to do so because there was some paperwork that got lost in the shuffle. So I tell everyone to go online over there at ssa.gov, or you can call Social Security or go get an appointment with Social Security just to make sure that you are good to go for your initial open enrollment period. Because if you don't enroll, there may be a penalty. So if you miss that 7-month window and you're without coverage for the next few months, it's a 10% penalty for every year that you go uninsured. So instead of that $174 for however many years you've been uninsured, you'll have an additional 10% tacked onto that, unless you are working or a spouse is working and you have what the government considers to be quantifiable coverage. So if your coverage is as good as what the government is offering in these Medicare plans, then you are not necessarily going to be penalized, but it's still good to check, talk to HR, figure out what that looks like, and create a plan that's specific for you. So then if you are still working, what do we do if you're still working? Well, as I mentioned, if you're on a good solid plan, you are not necessarily required to get that Part A or Part B, but sometimes it's nice to have. So if your employer has over 20 employees, then the group is going to pay first. So that means if you're with a carrier at your job, their insurance will pay, and then whatever is not covered that Medicare covers, they will pay second. If your employer has under 20 employees, then Medicare pays first and your employer pays second. So that's usually a situation where we would suggest that you sign up for Part B just so that you have that nice rounded coverage to make sure there's no holes. But you won't be penalized if you stay there. So what do we do beyond original Medicare? So Parts A and Part B, those are what we get from the government, but there are options to fill in that 20% gap that I mentioned earlier so that you are not paying 20% of all your medical bills. 2 paths here. So you can choose a Medicare Advantage plan on this side here, or you can choose a Medicare supplement. You'll notice here that this is in one big square. That's important. Remember that later. And these are in 3 different sections here. If we're talking about a Medicare Advantage plan, that is also Part C that we talked about in that Medicare alphabet. So we did A, we've gone over B, this is Part C. A Medicare Advantage plan is going to function a lot like an employer plan that you may be used to. They are not identical, but they are very similar in some aspects. So what it does is it takes Part A and B that you have from the government and it combines them into one health plan that is facilitated by a carrier. So that's gonna be the card that you hand to the counter when you go see the doctor. That's your carrier. And it takes all of the original Medicare benefits and just divvies them up differently. So instead of paying a large chunk for going to the hospital, you may instead have a co-payment, which you would have on an employer plan too. A lot of them do offer prescription drug coverages, which is really important. And a lot of them do offer some routine vision, some hearing aid, dental. A lot of them at least have the option. So it's a good thing to look into to see if you need any of these hardware benefits or any nurse advice over the phone. It's a really good resource for that. Another really big part of these plans is that the premiums are not age-based. So you can be 65, you can be 95, you're gonna pick the plan and that premium is the same for either person. When do you enroll in one of these plans? So you have the annual enrollment period every year, which if you are of Medicare age or know anybody that is, I'm sure you've heard about all the mail they get. October 15th through December 7th, that is the only time that you can sign up, drop, or change a Medicare Advantage plan. Okay, you can sign up for one right when you turn 65 in your initial enrollment period over here, but after that, you only have October, November, and December to make those changes. However, if you are on a Medicare Advantage plan and January comes around and you don't like that Medicare Advantage plan, you can then switch to a different Medicare Advantage plan or disenroll. So you're just going back to parts A and B. You cannot, however, go to a Medicare Advantage plan January 1st through the 31st of March. You can only switch from one plan to another. So it's a lot of different dates to remember, a little bit confusing. And then this last portion here, the special election period, that's going to come into play if you move and your carrier's no longer in the service area, or if you've got a plan and they pull out of the service area, that gives you the opportunity to sign up for a new plan. So that was a Medicare Advantage plan. Brief recap. Part C has co-payments, doesn't depend on age for the premiums, and offers various benefits like dental and vision potentially. Now we're gonna go into the Medigap plan. So these plans are commonly known as Medicare supplements as well. We like the name Medigap because it does what it sounds like. It fills in the gaps that Medicare leaves for you to pay. So instead of paying that 20%, you are now paying whatever the plan wants you to pay instead. So it definitely cuts down on your out-of-pocket spending. What it does is you have 3 cards. You've got your Medicare card, your Medicare supplement card, and then you're going to have a 3rd card for your prescription drugs. These plans are run by private companies. So you sign up for a Medigap plan with a carrier, and they facilitate all of the billing so that you don't have to deal with that. There's no prescription coverage included, and the plans do tend to be a bit more expensive because they are age-based. So as you get older, the rates get higher. The beauty of these is that there's no provider network. So whereas with an employer plan, you have to stay within the network of providers that they have. That's similar with Medicare Advantage, the Part C. With this plan, there is no provider network at all. You can go to any provider in the United States that takes Medicare, and Medicare will pay. So when do you enroll in one of these plans? Is it the same as a Medicare Advantage plan? No, I'm sorry, it's different. This plan, you have a 6-month enrollment after your Part B starts. So if your birthday is in January and you signed up for Parts A and B, then you're going to have 6 months after that to sign up for this plan. If you wait until after that period, you have to undergo what's called health questions, and you can be denied coverage for underlying conditions. The carrier does reserve that right. But if you sign up within this open enrollment window, six months, they cannot deny you coverage. It's what you call a guarantee issue, and you will be all set. Higher premiums, lower out-of-pocket costs, and you can also enroll in a Medigap plan if you move or your Medicare plan pulls out of the area. Part D, this is the prescription drugs. This is the last part of the Medicare alphabet that we talked about, and the easiest one to remember. D for drugs. Why do we have a prescription drug plan? Well, because drugs are expensive now. And so what a prescription drug plan does is it offsets the cost of your prescriptions. You do not have to sign up for a prescription drug plan, but if you don't and you sign up 10 years down the road, you can be penalized 1% for every month you went without coverage. So that adds up really quick. They are held by private companies, so you're going to get a carrier that orchestrates all those prescription drug plans. And the higher your income, generally the higher your premium is for that first year. And when do we enroll in this plan? Is it the same? No. Your annual enrollment period is going to stay the same. So this is the same date that the Medicare Advantage had, October 15th through December 7th. Everything will be effective January 1st, but there is no open enrollment here. There's no January 1st through the 31st. It is just the 15th to the 7th. That's the only time you can change a drug plan. And then the special election period, which is going to be the same as any other. When your carrier comes out of the area, whatever the situation may be, if you move, then you would qualify for this special election period. What do you look for? Well, you want to make sure your drugs are covered in a prescription drug plan. You want to make sure the costs are reasonable. You want to make sure you look at the drug tiers. So that means if you've got a general generic as a tier 1, or if you're looking at a specialty drug that's a tier 5. And then you really want to pay attention to the exception requests. So if you're in the middle of a year and you come on a new drug that's not covered by the carrier, you want to be sure that they will honor an exception request for the rest of that year so that you can get that prescription that you need. Back to the group coverage. So if you're still working, we've talked about, do we need to sign up for Part A? Do we need to sign up for Part B? Maybe. It depends. Part D is going to be the same way. So you don't have to sign up. Again, this is a voluntary program, but there is a penalty if you don't. If you have an employer plan that is a good employer plan, that the government deems is a good employer plan, you do not need to sign up for prescription drug coverage. But if you have coverage that the federal government doesn't believe is creditable, then you are subject to the penalty when you do finally sign up. So lots of moving pieces here. If you don't have what the government considers to be creditable, they will send you a letter that says you need better coverage. And then you'll sign up for a Part D plan. And it's not as painful as it sounds, I promise. There are good options out there to work with something like that. So, okay, we're getting to the end here. How do we enroll in Part A and B? Well, you're gonna talk to Social Security either in person or over the phone, or you can enroll online if that's what you like to do. Sometimes it's kind of confusing, but once you get in there and kind of get rolling, it's not super difficult. How do you apply for a Medicare Advantage prescription drug plan or a Medicare supplement plan? You find an agent like me or anybody else in Central Oregon that can help you do that. Enroll on the plan's website. You can enroll on Medicare.gov. You can call the carrier and enroll over the phone. There are definitely a ton of ways that you can sign up for these plans. So the big thing is when you're looking at the plans that it's the plan that fits what you need. So just because your neighbor is on one of the plans does not mean that that plan is going to be right for you. So just be really careful when you're finding who you're going to work with and what carrier you're working with to make sure you understand the ins and outs of all of your coverage so that you don't end up going to the hospital and not having coverage. That would be not good. And Medicare resources, these are always just good to know to keep in your back pocket. We've got Social Security again online, over the phone, or in person. You've also got Medicare you can call. You can go on Medicare.gov. It's an awesome resource. And then finding a licensed agent, really anywhere they can help you over Zoom. We can help you in person. We can help you over the phone. But having somebody that can help walk you through the maze, especially in your specific situation, is very important. And that's me, Sabrina Stout, again, Sage Health Insurance Services. This was a very broad overview of Medicare, but very important things here. Definitely get in touch with an agent to talk about your specific needs and what happens for you next, and you'll be all set.